This is Google MD Strikes Again. We're discussing things that Google MD has said, and we see if they have some factual basis.
Yeah, should I go first?
Please do.
I'll ask you a question. Your knees are destroyed if you hear cracking sounds.
I like what you did.
Thank you.
I mean, no. There are a few times where you should be concerned with noise coming from your knees, but there's a whole bunch of really safe things that could be happening in your knees which create sound. So let's go through them. If you've got a meniscal injury, something going on with the cartilage in between, if you have a pop and pain, and then maybe a locking feeling, like I'm stuck, or it gives way, like it gives out from underneath you, then you should be concerned.
But in that case, it's not the sound the issue, right? It's the pain and the locking is the thing that is what you should be worried about.
I mean, you're right, but hey, I'm trying to make an interesting video and relate it to this. Jeez. But yeah, so more the pain and the locking, which is the issue. The sound by itself isn't a problem. If no, that's all related to pain. Yeah.
So what we're saying is no.
It's fine.
It's fine, yeah. The point is, there's lots of things in a joint that move relative to one another. And when those things move, they can make noises. There's some fluid moving between different compartments. There's some things rubbing over one another. It's not a bad thing. It has to happen for a joint to move. And those things make noises. Sometimes there can be a change in how much noise it makes. That's maybe interesting, but again, it's not something to worry about. For example, swollen joints tend to make a bit more noise because there's a bit more fluid.
Penny, that's a good one. If you have a noise and then afterwards it swells, then you should be concerned about that. There you go. And it might not have pain. So there are some issues like biomechanical tracking issues, which then may cause more wear and tear or more friction, shall we say, that creates a swelling response. Then you might want to look at that and be like, okay, can I be preventive about this before it gets painful? Let's go with that. That's one, right?
Yes. Yes. But still, the point is that the majority of noises you hear from a joint, unless they're accompanied by pain.
So if there is a structure which is tight and it just flicks across a little bump, that can make a sound. It's not something to worry about. It can be very normal. There's a few right there.
Yeah.
You got it? There also can be cavitations. So, nice. You are an osteopath, aren't you? So if you have a change in joint pressure, which can create small nitrous bubbles forming, then it can create this pressure change which creates a pop, which is the joint cavitation that we often get with joint manipulation. So it's safe, you don't need to worry about it. Patella, there's facets on the back of patella, which means like, thank you. He's good. So
I can translate.
Yeah, thanks. So the kneecap, at the back of the kneecap, there's different angles which sort of glide against the knee as it's going through, or gliding against the femur, one of the bones there. If it flicks from one facet to another, that can sometimes cause a little pop and click. Again, nothing to worry about, but might mean you need to strengthen your knees. All right, let me give you one. Google says my headaches are from a brain tumor.
Well, they might be.
Don't tell them that.
But that noise you hear in your apartment late at night might be someone breaking into your house. It's probably not.
That's true.
It's almost certainly not.
Yeah.
So you list out causes of headaches. Right down the bottom list is brain tumors. So it's true that some brain tumors will cause headaches, but that should be the last thing that comes to mind.
I want to give you a window into the clinician's mind. There's something called clinical uncertainty, which if you're not 100% certain about something, you still have that as a tiny little thing at the back of your head, not the tumor, but the idea that it could be there. And you think like, okay, I'm going to keep that aside. It's definitely unlikely, but we're going to keep that there. The issue is that when you read Google MD and you see that as a potential, in your head, if you don't have any understanding of medical knowledge or of differential diagnoses, which was differential diagnosis mean?
A list of possible causes.
Nice. Then you might, think that all of them have an equal chance of it as the cause. So in a clinician's mind, we know that's like really, really small. I like to use Occam's razor. The idea that the simplest answer is usually the correct one. Usually a headache isn't a brain tumor. If it comes on with a load of other symptoms, like sensory loss or not being able to move your arm, something like this, then you think, okay, let's get a scan.
But then you're worried about not being able to move your arm, not about the headache.
This is true as well. This is true.
I mean, it's like you read on a paracetamol, Tylenol, all the things it might cause. How many people do you know who have died, had seizures from taking paracetamol? Like approximately zero.
No, definitely zero.
Yeah, I don't think you know anyone who knows anyone who has. But it's still listed there, and it's the same with headaches. There's much more likely that you're dehydrated, that the muscles in your neck are sore, that you didn't get enough sleep, that your eyes,
any of those.
Much more likely, to the point that you just wouldn't consider a brain tumor. Unless, I don't know, have you had a headache for 3 months non-stop? Yeah, probably see somebody.
And you get another symptoms too.
Yeah, exactly.
Nice. That one's done.
Yeah, I think so.
Is that yours?
Lifting weights is bad for your joints.
No.
No. Okay, let's move on.
Put that one down. No, look, if you go in and you try and lift a weight, which is way too heavy for you, and you do it in an absurd manner, then sure, it could be dangerous for your joints.
Or you do the same thing for hours at a time, every day. You know, so basically, if you load your joint beyond its capacity to adapt, then yes, weightlifting could be bad for your joints. But good weightlifting, good exercise in general, again, it's dose dependent. So you are gonna do it at a sensible amount that will encourage your body to adapt to it, and then you recover. It's not inherently bad. Joints don't wear out the more you use them. That's just not how biology works. We are anti-fragile, exactly. We're not fragile, we're anti-fragile. So you apply a bit of stress, the body gets better at resisting that stress in the future, as long as you give it a chance to recover. So no, it's the opposite. Lifting weights is good for your joints.
Done
with a few caveats.
Nice, that's easy. Posture is everything. If I just sit up straight, I won't have pain.
Basically nonsense. However, if you have pain, and it hurts in a posture, and you get out of that posture, it will get rid of your pain. And I think, this is maybe controversial. There's many people who are obsessed with posture.
Controversial on the internet, you sure?
Yeah, so you have one group of people, posture is everything, all your pain is caused by posture. I think, to be honest, that is maybe the dominant opinion amongst the lay person, kind of.
I've been slouching. This is the issue.
Pain,
Sleep weird.
Then the pendulum swung away from that. So hey, that's not true. But I think it kind of hit its
apex.
Thank you.
It's absurdity.
In that posture is never relevant. It's totally nonsense. I think that's probably also not true. If you are sitting in a hunch position, or holding your elbow in a fully flexed position, or holding your head in a fully flexed position for a long time, I think you will be prone to overloading. So overstretching, overstraining some tissues. But the idea that there's some kind of perfect posture in the middle, I think there's a bracket of good posture. It's not a point of good posture. So changing your posture can help with your pain, definitely. Is it the root cause of all pain? 100% not. Is it worth thinking about? Yes. Is it worth obsessing over? No.
Probably not. I think often we need to look at it as, in one posture, do we get effective blood supply and lymphatic drainage? You don't know about lymphatics. If we're getting optimal blood flow and lymphatic drainage from the area. If we're getting that in one stationary posture, probably not. So there's never going to be a perfect posture as well.
Your best posture is your next posture.
Oh, that's not original, is it?
No, definitely not. I read online that I can just pop my own back to fix my pain.
Wow.
There's the door.
Look, that one's absurd. I think that one is, dare I say, nonsense. 100%. The idea that pain can be fixed by just non-specific joint manipulation, particularly if we're talking long term, is nonsense. Also, if we go along with that, we think, is there a risk for you trying to manipulate your back by putting yourself in weird and wonderful positions to try to hear a crack out of it? That's probably not the best thing to do, guys. So if you're gonna have joint manipulation, have a professional do it for you when it's done in terms of a whole treatment plan, used as a modality rather than just the sole treatment itself. So it's not that popping your back is an inherently bad thing, but doing it yourself as someone who isn't trained and just looking for a sound, and to think that it's going to fix your pain.
Well, of course, also doesn't mean that it won't feel good and kind of help you at the time, right? So for some people, you pop your own back, you may have less symptoms for a period of time. But in the shrinking minority of cases, is it going to be the ultimate solution?
And I would look at it as from a percentage of risk, shall we say, like how much benefit to risk ratio are we getting? Are they going to get long-lasting positive change from it? No.
No.
Is there a slight risk that they could be causing some harm to themselves?
Yeah, slight.
Yeah.
Slight, but
So slight, but
non-zero.
And also, you don't know how they're doing it. Some people I see on like the bus or on a taxi, like they're, bang! Like, jeez, what are you
Please
doing?
be kind to yourself.
Exactly, like your cervical vertebrae, and you know.
Yeah.
So I would say that it may seem like it's a slight risk for you, who like knows when to do it and when not to do it, and how much force to put through it. I've seen some ridiculous stuff out there.
Yeah.
So yeah, I'd say just don't. One of my legs is longer than the other. Am I crooked for life?
I think that's actually quite an interesting and nuanced question, in that there are lots of reasons why someone may appear to have one leg longer than the other. One of the reasons is because one leg is longer than the other.
Yeah.
It is, symmetry is a myth. Nothing is symmetrical. Even if we're just talking like atoms longer, nothing is symmetric. One leg, guaranteed one of your legs is longer than the other.
Yeah.
It just might not be measurable.
It actually is.
Often is, for most people, there is a measurable difference. It's just not clinically relevant. For some people, a small number of people, it is clinically relevant that the bone is longer. These people are normally identified, and then there are strategies for managing that.
If you're unsure, just see someone.
Yeah, if you're unsure, just see someone. The other side of it is that it may look longer because you're lying slightly sideways, or because you have a slight asymmetry further up. So people with scoliosis, for example, often to kind of compensate or to balance the asymmetry in their spine, the pelvis then takes an asymmetric posture, which then changes the resting position of the legs. So is that a problem? Actually, in that person's case, the one leg being longer than the other actually allows them to be less crooked than they would be otherwise. So put those legs in equal position, the person would be more leaning to the side. So I like to think of things in terms of equilibrium rather than symmetry. I think symmetry is not something to aspire for, but perhaps equilibrium would be. So balance rather than symmetry.
Or even function. Right?
Function,
Well, I often talk to people like, you don't get mad at your non-dominant hand for not being able to write your name. So there's a whole bunch that we've just internalized. We're like, this is okay. This is non-symmetrical, it's okay. But for some reason, when some people see a hip a little higher than the other, but they're not in any pain and they're functioning very well, they sort of get like, oh, I got to fix that. And some of it comes from like old school ideas of the body of like, oh, take an X-ray and put everything in a straight line. But like, look at Roger Federer. Like, there's not symmetry in his body, or like any professional sports athlete, which is directional or one side. You will see difference. And I often like to also point out, like, look at nature. It doesn't.
That plant is faulty.
Yeah, exactly.
Send it back.
It grows to light, as you can see quite nicely with this. We've turned it off now, but it grows up towards it. But in the same way, photosynthesis, it grows toward light, which means it's function, and our function is movement. So if the movement you're doing every day means that you need to have more strength on one side, more control on one side, it's not a bad thing to have that. So that's another point.
So if it's really, really severe, as in very, very obvious, maybe get a quick once-over check. Particularly if you're also getting pain. But basically, no.
Done.
Resting too much might be making your injury worse.
That's nuanced. Okay, let's say you have an injury. Sleep and rest is super important for recovery. Like, as you were mentioning earlier, you being able to adapt for your body to have the chance to heal is super important. And that's been shown, unanimously in the literature. However, if you think, say, for example, you have a tendon issue, and you think like, oh, I'm just going to stop playing the sport and just sit on the couch for ages and maybe that will get better. Probably not.
No, exactly.
There is nuance there.
It depends on what the injury is, what stage of the healing process it is.
So you might need someone smart.
I mean, do you know anyone?
Usually, you're going to need a little bit of an increase in sleep. If you're going to stop or pause doing the thing which is painful, it's probably a good idea. You know? And then if it still isn't healing or getting better within a few weeks, go see someone.
I think there's I can't quote it exactly because it has naughty words in it, but settle things down, build it back up as a mantra. For me, that kind of summarizes it. Like, rest is often perfect at one point, but rest later on is totally inappropriate. So it's about timing, If I injure myself, I'll probably take it easy for a bit. But then I will also then deliberately build myself back up. I won't just stay resting until I feel 100%, because I probably won't ever get to 100% if I stay resting. But similarly, If you hurt yourself and you don't rest at all, most of the time that's also not appropriate. So it's relative, and it's how much rest at what point. So there's no black and white answer there.
And we also see a lot of benefit to exercising when you're not aggravating the symptomatic area. If you just get your blood pumping, the lymphatics going, and all of that, you usually get better healing.
Walking is a miracle cure for many things. Cure is a bit strong. Miracle intervention for many things.
Is that all of them?
Yeah, it's done.
Google MD for today, done.
Terrible.
That was sad.
Remember, this is all just fun. There's some really useful info in there, I think.
We hope.
But we hope so. Otherwise, we just wasted 10 minutes. But if you're worried about something, make sure you do actually check with a appropriately qualified professional.
Yeah, this is not medical advice. Done.